We are welcoming Brock Monger into the Stress List. Welcome.
Thank you.
You are the owner and manager of Apex Physical Therapy in Madras. We're going to talk today about how people can lower their risk of stroke. First of all, is that even possible? If we're at a high risk of stroke, can we bring that risk down?
Absolutely. According to the American Stroke Association, there are over 800,000 strokes that occur per year. And the estimates are that over 80% of those are preventable. And key preventable factors are decreasing high blood pressure and maintaining physical activity.
Maintaining physical activity.
Yes.
That's a big one.
It is.
And it's something that I think those of us in Central Oregon think that we already do. We get out, we recreate, we go hiking and fishing and boating, but yet some of that may not be enough. So how much exercise are we supposed to be getting to lower those risk factors?
Yeah, it's something that needs to be individualized. It needs to be something that is enjoyable on some level because it's so important. The Mayo Clinic recommends 150 minutes of exercise per week.
And that could be 2.5 hours a week. That sounds like a lot.
It does when you look at it in the big picture of a big bite of a week's time. But another way to look at it, it can be sliced up in multiple ways. 30 minutes of exercise or activity, 5 days a week, or a couple days where you do a shorter walk and then a longer walk. Maybe on the weekends you go to Smith Rock and get 60 minutes of exercise.
So it doesn't matter if you break it up into smaller chunks or if you cram it all into 2 days a week? Does it make a difference?
I would recommend not to cram it in 2 days a week. The body is meant to be moved on a regular basis, and everything functions better when we move with regularity. And so I would encourage it to be broken up, and I would encourage it not to be too dogmatic and too regimented because it will be more likely to be performed, and the health and the emotions and everything improves so much with exercise.
So we're talking walking, hiking, biking?
Biking, paddleboarding, yoga, getting in the water, whether it's walking or swimming in the water. We have fabulous water accessible pools here in Central Oregon and wide hours of availability. That's an option. Grocery shopping for 30 minutes, that's still walking. That may not be aerobic in nature, but it's still some mode of movement. I wouldn't necessarily count that toward the 2.5 hours per week, but at least it's movement.
The idea is just to get your body moving, get your muscles working. Now, for those people who maybe struggle with that, whether it's by injury or maybe they've lived that sedentary lifestyle for too long and their muscles aren't really strong enough to get out and do aerobic activity, is hope lost for them?
Absolutely not. No, and that's where working with a healthcare team that includes a physical therapist and the primary care a physician, we can work together with the patient, help the patient learn strategies that are helpful and learn manners in which they can move that doesn't cause pain, and getting down to the really root cause of what is the causation of decreased mobility, whether it's arthritis in the knees or back, or weakness, or decreased balance, or decreased flexibility. All those things are something that physical therapists, as movement specialists, we are very able and love helping patients with.
So for someone who might need that little extra help and incentive even to get out and get moving, is that something that a PT can a PT is needed long term, or is it possible to get them to a point that they can then go out and do the hiking, biking, walking, running that you're talking about on their own at home?
Yeah, that's a great question. As physical therapists, we prefer to help patients get as functional as possible, as quickly as possible. And so while there may be a long-term relationship with a physical therapist, it may be for episodes of care for various things, but not for one case like a low back strain for months at a time. Our goal is to get the person independent with their exercise program and something they enjoy doing in a reasonable amount of time, in an order of weeks.
We're talking with physical therapist Brock Monger about stroke prevention here on FM News 100 and 1110 KBND. Let's talk a little bit about what happens if someone does suffer a stroke. And just on a personal level, I had a stroke about 8 years ago that left me paralyzed on my left side. And I credit my neurologist for saving my life, but then I credit my physical therapist for giving that quality of life back to me.
Wow.
And that's something that I think people don't realize, that once you have a stroke, it's not the end of it.
Correct.
If you survive, there can be help available under the right circumstances. And you've worked with stroke patients. So what are, first of all, what are the challenges that they face?
The challenges are the weakness that continues on after the stroke event and the decreased coordination. There can be some speech impairment and sometimes some vision impairment. So the movement patterns can also be impaired. So we're talking about decreased motor function, and physical therapy is really helpful in reestablishing that, and being timely with early physical therapy is extremely important to reduce the long-term outcomes or the long-term consequences of that scary event.
Again, the idea is to get that immediate, it's almost like emergency care, but
yes,
obviously after the initial emergency, but that immediate care, and then get the person out doing the stuff on their own later.
Yes, and that's why early detection is so critical. And that there's an acronym called FAST, and FAST stands for F for facial drooping. That's a warning sign. It's not always the case, but it is one of many. And then A for arm weakness. That is oftentimes a sign, in that if someone's doing well and all of a sudden their one side is weaker than the other, they're dropping the coffee cup and there's no reason why, that's a concern. That's not a normal day. That's something that needs emergency reaction. And then S for speech difficulties. So if speech is slurred or impaired, not going well, not making sense, then that's also a warning sign. And then T is that it's time to call 911. And that what we know is that early detection and early treatment with emergency care physicians is so critical to make sure that the consequences aren't long lasting.
The idea is, and even in my case, if you know something's not right with your body,
yep,
or if you're looking at someone that is, like you said, not making sense, or they have weird asymmetrical weaknesses within their body, don't be afraid to call for help.
Absolutely.
And you work with people that have that one side weakness or the other.
Yes.
And when you're dealing with someone who has that sudden onset, have you ever had to say, hey, have you seen a neurologist? Have you had this checked out from the medical side of things? Or do you find that's typically muscular?
So in our physical therapy practice, we have not had an episode where a person has had the signs of an ongoing stroke. Where you see it
right then.
No,
you're usually seeing it after.
Usually hear about it well after, when we're helping the patient work on those movement patterns and strength and mobility.
How important is it for a patient post-stroke to have not only that team of professionals helping them through it, but also that moral support, emotional support during their recovery?
It's extremely important. It's important to have that empowering support from care providers. We as physical therapists, we feel that we're great at communication and educating patients and providing that motivation, and then educating the patient's caregivers, family members. This is an idea of what would be really helpful to the patient at this time. And it's easy to get discouraged when so much has been taken away. And it's great to have a care team that can provide that encouragement that there is a light at the end of the tunnel. Let's work together and let's do everything we can to optimize this.
There were times during my treatment I thought my PT was my cheerleader.
Yeah.
Kind of saying rah-rah from the sidelines as you go through treatment. And that is something you get kind of discouraged, that self-talk of, I can't do this. It's really hard when your body's not doing what it's supposed to do. And it means so much to have someone on the other end of that going, you can do this. Yes, it's hard, but here's what we're going to do, and we're going to move through this together. And I think people don't realize that physical therapists are a big part of that team. It's not just doctors and those people at the hospital or doctor's office. It's an extension of that.
Yeah. Yeah. And it's nice as a physical therapist to really remind the patient, day one, when I first saw you, this is what was really challenging. Here we are, a couple weeks into this. You're doing really well with this. I know that there's still some challenges. Things aren't going as easily as you'd like them to be, but we've made a lot of progress, and kind of give them a frame of reference for that.
We are out of time, but I want to make sure people know where you are. You guys just celebrated 10 years up in Madras.
Yes. Yeah,
so
we
congratulations.
did. Yeah, thank you.
And how can people find out more about you?
We are on Facebook. We have our website, apexoregon.com, and you can reach out to us by phone at 541-475-1218. And just wanted to say thank you to Jefferson County and all the referring providers that entrust us with the care of their patients for physical therapy needs.
Brock Monger with Apex Physical Therapy. Thank you so much for spending some time with us.
Thank you.
You're listening to FM News 100 and 1110 KBND.